So we're going to talk about the other organs again. So as we proceed, you guys know that we have, the male, they have two seminal vesicles, all right? We have right and left, and I would tell you that 70% of the seminal fluid is actually coming from the seminal vesicle, and that percentage you can remember it by that we call it semen. So of course, because we call it semen, it's formed mostly of the seminal fluid, seminal vesicle secretions. All right, so 70% is actually formed from here, and 10% only were the sperms, or less than 10% coming from the sperm itself and the testis, and 70% coming from here. And of course, the seminal fluid is very important because it has alkaline fluid that would neutralize the acidic vagina and prevent the sperms from dying as they want to reach the oocyte and fertilize them. So they have alkaline fluid. All right, they have citric acids to liquefy that secretions as they reach the female system to know how to fertilize the egg. And then also we have prostaglandins that are very important to all right, the prostaglandins, they are important to suppress the immune system of the female so that they don't attack the sperms. All right, so they are very important content of that secretion. We're going to talk them into more details in physiology. All right, so these are the two seminal vesicles. We have, the male system has two seminal vesicles. So as the ductus deferens comes down here, it forms the ampulla of ductus deferens, and then from the seminal vesicles here, they unite together to form the ejaculatory duct, and then again into the prostate here. And if you guys look at the prostate, we're going to talk about the prostate and their secretions in a while. They are more or less same as the seminal vesicle, but it's very important as we're talking about the journey of the sperms and how the ductus deferens comes into the pelvis, all right, from the perineal region. It's very important to talk about the water under the bridge concept. Remember, guys, we had the same concept with the female system, and it was very important because we need to know that the ureter runs below the bridge of uterine artery in female, and that was in lateral to the cervix, and that was important during hysterectomy so that we don't injure the ureters. The same idea we have it here because in some surgeries like the vasectomy, where the surgeon wants to ligate the ductus deferens, we need to know that the ductus deferens is actually running and on the top of the ureter. So we have that concept here, the water under the bridge concept. It's in the lateral aspect of the seminal vesicles. So this thing happens, if you guys look at this is the seminal vesicles. All right, so in the lateral aspect of it, you get to see the water under the bridge concept, all right, on the above the upper end of the seminal vesicle. All right, now we're going to talk about the prostate. The prostate has been classified into loops and zones. All right, so when we talk about the loops of the prostate, we have 5 loops. We have the anterior loop, we have 2 lateral loops, median and posterior. So the anterior is actually the fibromuscular stroma. You guys, again, we talked about the idea of the stroma and parenchyma. Whenever we talk about histology, we have many classifications, and one of them is the classification based on the function. So when we do histology based on function, we classify the organ based on the function into stroma and parenchyma. And parenchyma means the tissue that is actually doing the function. And in this case, when we talk about a gland, which is the prostate, it means the glandular tissue. And the stroma is the supportive tissue that supports the function of that organ. So when we say that the anterior is the stroma, it's the fibromuscular, it's basically the fibromuscular tissue. It's a non-glandular, it's the stroma of that organ. It supports that organ, and this is actually your anterior part of the prostate. And the same idea you have it when you talk about the zones. The anterior part is nothing but the fibromuscular stroma. It's formed of smooth muscles. We're going to talk about that in the histology. And this is the anterior loop. Now, the glandular tissue is actually everywhere else. Now, if we have a part of a loop between the urethra and your ejaculatory ducts at the back, it's going to be the median loop. So if we have a glandular tissue on either sides of everything, it's going to be the lateral loops. And posterior to the ejaculatory ducts, you have the posterior loop. And if we talk about the zones, if we have a zone that is around the urethra, remember that this is a transitional epithelium. Remember the transitional epithelium definition. All right, so that's why we call it transitional zone. It's the zone that's all around the urethra. If we have a zone that is all around your ejaculatory ducts, it's going to be the central zone, because ejaculatory ducts are the important ones in everything here. So we're going to give it a central zone. And if we have everything else all around the two important zones, one around the important structures, which is the which is the ejaculatory ducts, all right, and another one which is around the urethra, which is the transitional zone. Everything around them of glandular tissue is going to be the peripheral zone. All right. However, the anterior part is, like we said, it's just a fibromuscular stroma. It does not fall under the zones or our loops. All right. Or we can give it anterior loop, but we don't give it any zone. So we have 3 zones and we have 5 loops. Now, I want you to remember one thing, which is very important in your examinations. It's how you will remember the site of the cancer, because prostate is a very important organ when it comes to cancer. God forbids. We have 2 types of cancers. I mean, we have so many types, but most commonly 2 of them, which is the benign prostatic hyperplasia, all right, and we have the prostatic carcinoma. Now, both of them, they have parts that are most commonly seen in one of these 2 types of tumors cells. All right. Now, how will you remember that? Remember that you have your median zone. All right. In the benign prostatic hyperplasia, it has the benign. It has a letter N. So what has the letter N in the loops is your median loop. So median loop, as you can see the arrow, it shows you that this is the place that is most commonly affected in benign prostatic hyperplasia in your examination. Remember that if we're going to ask about loops, it's the median loop. And if we're going to talk about the zones, it's the transitional zone. It has N letter. Now, if we're going to ask about the carcinoma, remember that carcinoma has the letter R. So the most commonly seen lobe affected by the carcinoma is the posterior R loop or the peripheral zone. So, so this is how you can remember where you get to expect to see prostatic benign hyperplasia, median or transitional zone, and the carcinoma R is the posterior loop or peripheral zone. All right. How can a physician palpate for that? It's by the perectal examination. He can, if he puts his finger in the rectum, he can palpate, and when he does so, he can feel the posterior parts of the lateral loops of the prostate and the peripheral zone, if we were to talk about the zones of the prostate. And this is how they feel for any pathological changes. Now, what can happen if that patient has a benign prostatic hyperplasia? Very briefly, from anatomical side, that patient can have a continuous erection, because can you guys see how the benign and transitional zone can be showing pathological changes, and because that happens, that is going to press over the organs around the prostate, and if that happens, we're gonna compress against the periprostatic venous plexus, and if that happens, guys, remember or we're going to talk about that. Remember, because I explained it in real life, but I didn't prepare the video for the perineum yet. But when you hear the video about the perineum, you will come to know that the deep dorsal vein is the vein that gets compressed during erection. And if there is difficulty in draining the blood in the deep dorsal vein, it means that patient will undergo continuous erection. So this is can be a red flag for you guys. If you have an old male patient coming to a clinic with continuous erection, you would think about the benign prostatic hyperplasia, because that prostate can compress the periprostatic venous plexus, and making it difficult for the deep dorsal vein to drain the blood from the penis, and that ends up having continuous erection. Another thing is that can also affect by the same way, causing bladder varices, because that will make it difficult for the urinary bladder veins to drain, and also because that venous plexus receives from a lot of veins all around the bones in the pelvis. It's a very common site of bone metastasis. So a patient can discover at a very late stage cancer in the sacrum, for example, bone cancer. And the reason why that can happen is because of the prostate, because there are a lot of channels in between the bones of the pelvis and the prostate. So you would expect the source of cancer to be the prostatic cancer. All right, so these are important clinical correlations you guys need to know when you study the prostate. The last thing is here, if you look at the internal structure of the prostatic urethra, you'll get to see that there is an elevation called urethral crest. And if you trace it all the way down, it's going to dilate, giving something called the seminal colliculus. And that seminal colliculus is very important because it's a reference in the transurethral sectioning of the prostate. So the physician needs to be aware of how it looks like. So as he puts his endoscope inside, reaching, and once he sees this bulging, which is the seminal colliculus, he knows that now he reached the prostate, and he can go ahead and do the sectioning of the prostate. All right. Another thing is there is something called the prostatic utricle. It's actually the remnants of the atrophied or non-developed paramesonephric ducts, which was forming the uterus in female. All right. So the prostatic utricle is a homologue for the uterus in female, but here it did not grow, and it gave us instead the prostatic utricle. All right, and both sides of the prostatic sinuses, on both sides, sinus means a depression. On both sides of the urethral crest, you have two sinuses. You get to see the openings where the prostatic glands are going to release their secretions. And here we are reaching the end of the journey of the semen, adding up 20% of the seminal fluid to the seminal vesicle secretions and the sperms, and now they are ready to be ejaculated through the urethra. All right. The blood supply is going to be explained into details in a separate video, so make sure you watch it when it's uploaded. And then moving on to talk about the innervation of the male system. The innervation is formed by sympathetic and parasympathetic innervation. We have a plexus superiorly called superior hypogastric plexus. This hypogastric plexus is actually formed by the upper T12 and the upper lumbar segments around 1 to L3. These are sympathetic fibers, and then they will give you right and left hypogastric nerves. All right, if you guys look at the pictures, you will get to see the right and left hypogastric nerves coming down to here, and coming down to the inferior hypogastric plexus, and the inferior hypogastric plexus receives parasympathetic innervation. So this is the inferior hypogastric, this is the superior, and these are right and left carrying sympathetic fibers. So here you have sympathetic fibers, And from the pelvic splanchnic nerves, S2 to S4, you have the parasympathetic fibers, and these fibers will, with the sympathetic coming from the superior hypogastric plexus, you will have the inferior hypogastric plexus, and from there you will get the innervation to the male system. So if you look at the two right and left hypogastric nerves, bringing sympathetic innervations from the superior hypogastric plexus, all right, right and left, they will come down, and then the green ones, the parasympathetic fibers coming from the pelvic splanchnic nerves, together with the right and left sympathetic fibers coming from the hypogastric, they will form the purple, the mixed nerves. Now these nerves are ready to innervate the male genitalia or the female genitalia, mixed nerves. All right, so the yellow ones are the sympathetic, the green ones are the parasympathetic, and the purple are mixed. So here you have your final innervation coming from the inferior hypogastric plexus. All right. Now, the last thing is the lymphatic drainage. The lymphatic drainage is actually, these are lymph nodes around your blood vessels. So if you guys, we're going to talk about the blood supply of the pelvis, it's coming from the internal iliac. So if the internal iliac is giving you all the blood vessels of the genitalia, it means that you need to drain into the lymph nodes that are wrapping around your artery, right? So it's going to drain into the internal iliac lymph nodes, and from there into the lumbar lymph trunk, and from there into the thoracic duct to the lymph to the left angle. All right, and if you guys don't, again, if you don't know about the lymphatic system and how the system works, please go ahead and watch the overview of lymphatic system to understand what do we mean by this line here. So again, what you need to know is the name of the lymph nodes, the name of the trunk, and which duct drains where. This way you will, you know, the whole idea of the lymphatic drainage. But the only thing I want you to pay attention to is that when we talk about the skin, the scrotum or the penis, they drain into the superficial inguinal lymph nodes, and from there into the deep inguinal lymph nodes, and from there to the external iliac, because the skin is of the scrotum is following that route. Okay, so don't get confused with that internal genitalia. Another thing I want you guys to know is when we talk about the testis or the ovary, remember that these organs were coming from the abdomen. Their arterial supply is branches of the aorta. So the first place that the lymphatics will go and spread into is going to be the para-aortic lymph nodes, exactly like the ovaries. All right, we're going to have some of them going to the internal iliac, of course, but mostly they will go to directly to the para-aortic lymph nodes. So this is also an area of exam questions. Remember that the scrotum is the same idea of the lower part of the anal canal. It's the same idea of the lower part of the vagina. They are all cutaneous structures. So if we are at a cutaneous structure, skin, you need to follow that route if you are asked in the exam. Okay, superficial inguinal lymph node, and this is your route. So remember, this is very important information. And the testis again and the ovary is out of all of that because they are abdominal organs. So they would drain directly into the para-aortic lymph nodes, and anything else in the pelvis, it would follow the internal iliac lymph nodes, because the internal iliac is the artery of the pelvis, and the lymphatic drainage would have to follow the lymph nodes wrapping around the internal iliac artery. All right, thank you guys for watching. Don't forget to like and subscribe, and see you in the next video, where we're going to talk about the histology of the male reproductive system. Thank you, guys.